So I'm going to start. I'm going to welcome you guys here, and I'll tell you that our guest mentor tonight is Dr. Jeff Klemens, and he is fabulous. He's one of our Ready Vet Go mentors. So for those of you who, this is going to be recorded, and people did submit questions to me that were not able to make it. So there's going to be plenty of questions, and people will be watching this on demand. For those of you who are joining us, hopefully you are part of the Ready Vet Go community. These events really are for community members. If you're not part of the Ready Vet Go community, I'll drop a link into the chat so that you can join and get invitations for all of these events. So I'm going to introduce Dr. Jeff, and he, like I said, is one of our Ready Vet Go mentors. I have lost Jeff's bio. Hold, please. Okay. So Dr. Jeff Klemens, he's a small animal veterinarian. He graduated from Purdue in 2005, and he has had just a really amazing career. He's worked in lots of different places, multi-doctor practices, 24-hour emergency and critical care, and then relief. And he is now a full-time relief veterinarian. He practices really high levels of medicine and surgery. So for those of you with medicine and surgery questions, he's going to be great for that. But he also is really experienced in so many other aspects of veterinary medicine. He has a really fun non-veterinary life. He's an avid board gamer. He loves craft beer, which he brought tonight, which I'm sure he'll tell us about, and is a sports fan, a sci-fi fan, travels. He is the owner of Reliable Relief Services and provides mentorship both for us at Ready Vet Go and for a small corporation. And he's a really amazing mentor. And Jeff, I'm so thrilled that you're here. I'm going to let you take over from here, and then we'll open this to a Q&A.
I'm happy to do it. I'm happy to be here. I'm very interested in the submitted questions, so I look forward to that. Yes, this is Danny and I were just talking before we started. I am coming to you from Brewery Vivant, which is one of my favorite places in Grand Rapids, Michigan. It's an old church that they converted into a brewery. They specifically do a lot of Belgian style ales. If you like sour beers, their house sour is absolutely one of the most amazing things you can ever ingest. And while you're there, should you be in Grand Rapids, you absolutely should stop by. You should have some duck confit nachos, and then you can enjoy whatever's on tap that day because there's always something delicious. So there's my plug for Brewery Vivant and the wonderful people of the state of Michigan.
That's awesome. I figured you would definitely have something cold to bring and to share with everybody. One of the events that Jeff hosts for another group is Cocktails and Cases, where people can bring a cocktail and talk about a case. So I'm going to open this up to questions. There's a couple people that are here live. So for those of you who are here, if you brought questions with you, you can come off mute since we're a small group, or feel free to drop your questions into the chat and I will read them for you. And I'll give it a minute to let people drop into the chat. And then if you guys don't have questions, then I will ask the questions that were provided from the community.
Is there like a red, is there like a blinky light? Like, do I get a, hey, I have one more minute to finish answering this question?
Exactly.
Is there a prompt?
Exactly. I had a question that was in the Ready Vet Go community from a veterinarian. I think it might be a student, because they were asking about going into what you suggest about going into general practice versus emergency as a new veterinarian.
Like as a graduate?
Mm-hmm.
Oh, wow. I mean, I think hats off to you if you want to come right out of school and jump into the ER pool. That is that's a steeper step than going into general practice. I think that's a question that you need to kind of have a little sense of self if you're going to make that choice. You know, if you felt like when you did your ECC rotation in your clinical year, like if that really, you were like, man, this is where it's at. Like, I love this. I love this pace. That's just, it's hard. The learning curve is steeper if you go right into ER. Now, if you can do it, I've always said that 1 year in the emergency room is worth 2 in general practice. You can work the same number of days, but you will do more, you will see more. What you won't get is some of the basic wellness aspects of what we do. You're not going to do a lot of that in the ER, which is fine. Like if ER doesn't suit you, you can come back out into general practice or some other avenue, and that's easy enough to pick up. But no, I think it's not what I would do. It wouldn't be the thing that I would recommend to most. But I think if you are an apt student, and again you've had some experience in that world and you're passionate about it and you're ready to do it, I think you can find, hopefully you can find an ER that helps onboard you in a slow way. It's not, hey, welcome to the ER, you work Tuesdays, Thursdays, and Saturdays. Like there's hopefully you have some, you're not just going to dive into the deep end of the pool right off the gate, right from the start. But that's, you will certainly be well compensated. You will have a freedom of movement in your personal schedule that's kind of nice. That's one of the other nice things about working ER is, you might work 3 or 4 days a week and then have a long chunk of days off, which is absolutely inviting. So that's a nice perk. But it's, again, the learning curve is steeper. So just be ready for that.
Yeah, that's a good answer. For those of you who are just joining us, Dr. Jeff was just answering a question from a new grad about going into emergency versus general practice. So that was a really great question. We do have a couple more people who recently joined. I want to welcome those of you who are joining us. We have Dr. Jeff. He's a really amazing veterinarian. He's a Ready Vet Go mentor, has a ton of experience. I think just so that we can kind of help tailor the answers and I can tailor some of my comments as the moderator, I would love to know who's here. There are a few of you here who I don't know, and I'm thrilled to have people here that are new to the Ready Vet Go community. So if you can utilize the chat, maybe drop into the chat. Are you a vet student? If you are a veterinarian when you graduated, and if you're a vet tech or some other veterinary professional, let us know who you are and what year you graduated, if applicable. And maybe let us know also where in the world you're joining us from. I'm really grateful to have you guys here.
Yes, contest for the longest distance from Central Indiana, because that's where I am.
Yeah, perfect. Okay, we'll see if we can do like a giveaway.
Yeah.
And if somebody can just drop into the chat, even just a hi, to get the conversation started so that I know that the chat is working. I have been playing around with webinar features versus meeting features, and the webinar doesn't allow the chat. So, long-term volunteer and foster with the SPCA in Canada. Welcome. Thank you for joining us.
Jan, early leader in the clubhouse with distance.
Yeah.
Across a border already.
Exactly. I know we're touching lives all over. I'm thrilled to welcome you.
British Columbia. Beautiful.
Perfect. For those of you who are also just joining, let us know where you're joining us from and where you are in this veterinary profession. Like I said, I have some other questions from people in the Ready Vet Go community, but we are a small group. So I'll encourage those of you who are here to take yourself off mute if you have a question for Dr. Jeff. This can be a medical or surgical question. This can be a leadership question. This can be a career question. This can be a question about beer. So any of those things. So I'll pause now and see if anybody has a question. You want to come off mute or drop something into the chat.
There are no dumb questions.
Definitely not.
No dumb.
Hopefully, if you're here, it's because you had a question and maybe you were just hoping to hear what other people's questions were, which is also completely fine. I also know that it can be a little bit intimidating asking a question in front of a group of people that you don't know. I will invite you to direct message me. I will not say your name. I will be happy to read your question. There will be zero judgment on my part, but I'm Danny. You can direct message me here in the chat, and then I will read your question on your behalf if you feel more comfortable doing it that way. While we're thinking about questions, I wonder, Jeff, if you could just talk a little bit about relief practice and how you found yourself there, maybe a little bit about your career journey, because it has been a little bit twisty and windy, which is one of the things that I love about the veterinary profession, that we can really make it the career that we want. And you have definitely done that. So if you want to take a little bit and maybe just let us know about your career journey, I think people would be interested in hearing about that.
Sure. So I spent the first 2.5 years in a multi-doctor practice in North Central Indiana that was kind of a larger town in a more rural setting. So after that job, I moved to a much more urbanized area in Northwest Indiana, and that was 5 years of really having the opportunity to work at a hospital that had all the bells and whistles. You know, I'm certainly the clinician that I am today based on a lot of the time in that clinic, and then I transitioned to ER. The transition to ER was sort of accidental. I had a classmate, and we, you know, we're both a little kind of disenchanted with where we were. We felt like we wanted to have a little more control and a little more say in how things went. So we were gonna go together and buy a clinic, and we got really close. We were at the point where it was time to get a nice banker to loan us a large sum of money, and my classmate decided that she didn't want to be a veterinarian anymore. So that was a really sort of tough conversation to have over dinner one night. But thankfully, you know, she made that observation before we were committed. So that was helpful. At the time, I was doing relief work at a local ER, and they were in need of a doctor, and I needed a job. So I became an ER doctor, and I did that for almost 5 years, predominantly nights. I saw a lot of stuff. Like I said, I think again every year is worth two. So you know, that was 10 years worth of cases, you know, because of just the speed and the pace and what you see. But when you do ER work, it's kind of like when you do relief work, where you know you meet people for the first time. You're not necessarily you're not gonna know the person that walks into the exam room. You don't have a previous relationship with them, so the transition to relief came with some life changes and a move, and I was doing some relief work on the side because I was a younger guy at the time, and I was working an overnight and then going and working a GP day shift, and then kind of doing it backwards. Or so I had tested the waters and found that, you know, I think to really do relief well, you have to be able to play in somebody else's sandbox. You have to be able to use somebody else's tools, and you have to not have a super rigid way of thinking. You have to really be malleable, because every clinic is not necessarily going to have, you know, the things that you really like. So it doesn't bother me. I like new places. I like new staff. I like control of the schedule. That is a very, very strong pull to do relief. And that's since 2018, that's what I've done. And it's really hard for me to think about going back to full-time associateship, because I've just gotten used to this lifestyle. And I love it. So it's, you know, again, you have to be flexible. You have to be a little malleable. You have to like, you know, meeting new people. This is not for introverts. That's for sure. But yeah, I think it's, you know, you taste a little. I've had a good amount of time in a couple of different avenues, and you know, now through relief, I've worked at single doctor practices. I've worked in specialty referral. I've worked in ECC and urgent care. And it's great. The variety is, I mean, that's why I say variety is the spice of life. Like, it's true. It keeps things from getting boring. So
That's a crazy story, Jeff, about wanting to open a practice and then you having to really pivot. And I think that is just one cool thing about this profession. And it's also so interesting that you talk about not being an introvert, because I think that that is really the nature of many veterinary professionals. We are by nature quite introverted, many of us. And it's really interesting to hear you say that one of the features of being a relief veterinarian is maybe being a little bit more extroverted. You're finding yourselves in so many different situations that you have to be so malleable and so flexible. And that might be a reason why you have, been able to have such success as a relief vet. Somebody dropped into the chat wanting to know if you could relate one of your most memorable cases. And then also if you have preferences for which types of animals you like to work on most.
So I'm a dog and cat person. I'm a rat owner. I have a rat doctor, so I'm not my rat's doctor. I'm a better rat doctor than I used to be, but procedurally, I'm lucky to have a really good exotics clinic in the Indianapolis area that I can use and support. But yeah, I think if you really force me to commit, I'm a cat person. I have become a cat person over time. When I was still doing general practice, we instituted cat-friendly practice and strategies related to cat-friendly practice. And from there on, it's, me and cats just get along better because I changed the way I do things. And it just took a couple of owners with spicy kitties who, man, this is not their jam. Like, this is not their idea of a good time. And that was before I had gabapentin or pregabalin. Like, I was just doing, it was just technique and method. And man, now I have a nice little PVP that can go along with that. And that's, so I think here, the segue is, I had one of my clinics, that not everybody has the cat-friendly practice mindset. So there are ways that you can get things done. I spent a good bit of time with an owner one day with a very spicy man. He did not allow me to do anything that day because I could just get to the front of the cage or the carrier, and he was already hissing and swatting at the cage. And so normally he would get induced with some ISO to allow things to happen to him. And so I just talked to the owner about, hey, would you be interested in trying something different? And we talked about carrier desensitization and travel stress and clinic stress. And, every time he comes here with that sort of method, somebody threw you in a box and threw you in a car and took you to a strange place, and then you fell asleep for a little while, and you woke up and things had happened to you. Like, regardless of what you are, you're not likely going to have fond associations with that experience. So I got her some GABA. We talked about how to short trips, how to get used to the carrier, how to come back. We set an appointment in a couple months. The technician that was helping me, she said, I don't think this lady's going to do that, because ultimately she scheduled the follow-up appointment with the other doctor who doesn't typically have sort of cat-friendly practice mindset. Well, that cat showed up. I was actually out at WVC for the WVC convention, and I got back, and that staff member was like, hey, I kind of had a small win while you were gone. And I was like, oh, tell me. She goes, do you remember Poncho? And I was like, oh, sure, the super spicy Poncho. She said, yeah. She's like, well, she came back. I was like, oh, how'd that go? She goes, well, I just figured we were just gonna do it the other way. And she's like, oh no, I did all the stuff. Let's see what happens. And she totally did it. They did the full exam, they did all the vaccines on the cat, they didn't give the cat any ISO. And everything was great. And I told her, I was like, no, that's not small. That's big. That's a big win. That's because that just demonstrates that look what we can do with just a little just a little tweak in strategy, and sometimes just a little something just to kind of help chill things out. And she said the first thing she noticed was he was just chill. He was just sitting in the carrier. He wasn't talkative. Now, he didn't volunteer to do this. He did not say, "Oh, sure, let's go to the clinic today. That sounds grand." But we we did the things. We did a good exam. We got his vaccinations done, and we did it without induction with ISO anesthesia, which to me is that that makes me happy. That's and that's what I told her. I was like, it's like this is not like this is legit. Like, remember this. Like, this is what we're doing. Like, and ultimately that owner was really happy. So everybody wins. Yeah. So maybe not like we can get there's plenty of I have a dog versus list. When you work in the ER for 5 years, I've seen dog versus fill in the blank. Numerous projectiles, numerous types of vehicles. So we can get into the other end of that coin, but I feel like, oh yeah, cool. Thanks for the question, Jan. I'm happy to. That's a good one. That's a good one.
That was a really good one. And I always like to ask for wins when we're working with our mentees, and that might seem small, but that's actually huge. Really the trend, thankfully, is moving more towards fear-free and cat-friendly types of practices. And the days of ISOing down our patients so that we can handle them, thankfully, are moving right along. And we're using all of the tools at our disposal. You said gabapentin, and then did you say progabalin?
Yeah, pregabalin. Yeah,
Can we
there's
talk
a
about that? Because I don't use that. I don't know if anybody else wants information about that, but I would love some info about that.
yeah. So it's I think Mark Papich. I like to listen to his pharmacology lectures because a lot of his stuff is very literature driven, and he talks about how when we really look at the pharmacokinetics of some drugs, like yes, we prescribe them, yes, we use them, yes, we say it has this effect, but when you really look at the pharmacokinetic studies, the data does not necessarily support that. So a couple of years ago, he had a lecture where he said, pregabalin is probably going to be the drug that we want gabapentin to be because they're very, very similar. There is a liquid suspension that's been licensed in the US for travel anxiety for cats. That's a pregabalin suspension. I've only used it once because it's really brand new, but it seemed to work great. I think it's sort of a get used to it. A lot of people, pregabalin is Cymbalta, so a lot of people are familiar with Cymbalta because it's a drug that's readily used for mental health. It's used in headache and migraine pain management. So I think I love GABA, but if pregabalin from a pharmacokinetic standpoint is going to be a thing that maybe has more of an analgesic and still provides you that little bit of decreased arousal and anxiety, like cool, and that's gabapentin based on your state might be something that's kind of a pain to deal with, based on how the state views it in a controlled way, because that is different from state to state. Here in Indiana, we are not supposed to dispense more than 72 hours of gabapentin from the clinic. So that's fine. But that means if you want to dispense, you can, but then you have to report it to what's called inspect, and that's the state's controlled substance surveillance system, which ultimately is based in opiate prescribing in people. So this is a way to make sure that we're not over prescribing to people. When the people who created this, they didn't really think about veterinarians, unfortunately, because we are different in that we are both prescribers and dispensers, whereas on the human side, prescribers and dispensers are typically separated. Not that you can't get things from your general physician but usually you're going to a pharmacy to get your prescriptions. So it got a little wonky, here in Indiana. But yeah, I think
Yeah,
it's a,
that's so interesting. I didn't realize that about the number of days for prescribing. I'm in California and we don't have that, but I think it's probably coming for many states.
yeah, yeah. And it's, it's a hassle. Unfortunately, it means that there's a lot of clinics. Like I used to use a lot of alprazolam. Um, I love alprazolam from a anti-anxiety standpoint. Like it's one of my oldie but goodie PVPs, pre-visit pharmaceutical. But most clinics don't keep benzos in there outside of injectable for anesthesia. Like there's a lot of clinics just the reporting, the monitoring, there's just so much of a hassle that, man, we'll just script it out. We don't want to have to deal with it. So that's kind of a bummer, because it does limit some of the things that you have quickly. It's a weird thing to ask someone, hey, can you go to the pharmacy and pick up 3 alprazolam? Because we're gonna try this. Like, I don't know if this is gonna work for your dog, but let's give it a shot. Um, so yeah, and I think what we'll see is, I think I've seen people starting to use pregabalin in dogs. Like ultimately, you're using pregabalin in the same way that you would use gabapentin. I have not reached for it for dogs yet. I've just, again, started to use the commercially available suspension for cats.
Great. Well, that's good. I'm glad to have that on my radar. Thank you for that answer.
Hmm.
I have another question from the community, but before I put that into the room, I'll pause and see if anyone who's on here live has any other questions. You can feel free to come off mute or drop a question into the chat. And I've perfected the long pause while I wait. So I will wait. I know typing takes a minute, and I know that it can take some courage to ask your question
Sure.
off mute. And again, the offer
Sure.
still stands. If anybody wants to direct message me, I'm happy to read your question and not say where it came from.
This is the same thing as when you go to a lecture and they say, anybody have any questions? And nobody raises their hand, and then everybody starts to file out, but there's like a half a dozen people that suddenly like run up to the speaker.
Always,
I don't want to say it out loud.
always. Yep.
Yeah.
So the question that was in the Ready Vet Go community was from a veterinary student, and she said that she started vet school knowing for sure that she was going to be a veterinary oncologist, and then she had to take a small ruminant class, and it basically blew her mind. She loved it so much that she's thinking of having a career change, and it's causing an existential crisis. Not a career change, a pivot within veterinary medicine. And she's at a veterinary school that is not a big ag school. And she wants to know how to get mentors in spaces where she is not really familiar. Like she would have had mentors easily in small animal and in oncology, but now she's feeling like she wants to explore other places and doesn't really know where to look for mentors. And I think this would apply to veterinarians and vet students no matter what the field you're thinking about. This is kind of, I loved this because I thought it was a good general question just about
Yeah.
networking and finding mentors, which I think we can all relate to. So
Sure.
there's your question, Jeff.
Man, goats and sheeps, and wow, that's wow. So, do it. Do not question what you feel like. Do it. Um, I would start with the small ruminant, whoever is the instructor, whoever are the clinicians. Like, even though it's not a big ag school, someone has to be teaching you something. So I think that's the place to start, is have a conversation with that person, because those people are going to know other people in the large animal, small ruminant world. So I think that's an easy first step. If man, depending on where this is. So, do you have any idea like what part of the country this person is
I think it was
from?
Florida.
Okay.
I think it was
Man, I
Florida.
got lots of horses in Florida, but I don't know how many small ruminants you have in Florida. Um, you got some horses with like goat friends or something? That's what you need. So,
I was
so
wondering about externships. I think those are getting more
yeah, I think,
popular.
and that's the next step, is after you've talked with who do you know in the community locally that your off-campus opportunities, like hopefully you have more than one, or you can work it out that you can get an extra one. But I would say any hour that you have in your off-campus time needs to be in that realm. Like it's you need to spend that time because you know you might not know so if you are a city mouse and you would like to work as a country mouse, you might need to meet and just get to know some of those people um, because they're different. Um, they have a different background. They might have a different view of things. You need to be ready for some weird hours. Uh, you know, lambs show up at 2 a.m. So that's a tough job. I have a lot of respect for people that do large animal medicine, whether it's cattle or equine or small ruminant or llamas or alpacas. You know, you're out in the elements. You're putting in some real work and some hard hours. Um, but we need you because I cannot do that job. So
We need food animal and ruminant veterinarians,
yeah,
definitely.
yeah.
And the other thing, somebody just messaged me and just said that calling local rescues would be a great way to maybe see if there's any local like ruminant rescues and pick the brains of people who are affiliated with those groups. I think that's a really good
Sure.
idea.
Yeah. Yeah.
We had talked about externships, and my own personal question for you is that you did your externship in Denmark, is that correct? During vet school?
That's a true statement.
Can you talk about that?
Copenhagen is a beautiful place. It was so I'm really lucky. I had a lot of opportunities as a younger person to travel. I went to Australia and New Zealand as a high school student. I went to the western coast of Europe as a high school student. I went to Costa Rica as a high school student. I did a semester in the South Island of New Zealand when I was an undergrad. So when I got to Purdue, it wasn't a question of was I going to do something internationally. It was a question of where. In all of that travel, although I was in countries where English wasn't the primary language. I was in many countries where Spanish was spoken, and I was with a Spanish teacher in high school, so I was using my Spanish and my English, so I could. It wasn't perfect communication, but I understood the words. I could communicate in Spanish. I could understand sort of conversations that were happening around me. In Copenhagen, I don't know if you've ever heard someone speak Danish or Finnish or Swedish. Scandinavian languages sound very strange and they're very hard languages to speak. So it was the first time, even though I was 27, 26, I was 26. I had a real culture shock. It was a little alarming. I was at the Royal Veterinary College in Copenhagen, and it was sort of summertime. So the college was on break. Vet students were there, but most of the undergraduate students were gone. So it wasn't a lot of activity. But when you walk down the street and you don't hear English on the radio, and you don't see English on the newspaper, and you don't hear English being spoken around you, it gives you a real appreciation for people that are in this country that don't speak English. Like it's isolating. It was really like it took a minute. The nurses at the college made me a shorthand list for the grocery store so I could know what turkey was and I could know what sort of basic ingredients were. Um, but it was once I got over the culture shock, it was incredible. It was just seeing how medicine works in another place. There were some really striking differences that, you know, were very interesting to me. Oncology was, there was a real social misunderstanding of chemotherapy in animals. The Danish people really felt that it was cruel to put animals through chemotherapy. Her name was Anne-Marie Christensen. She did her doctoral work at University of Minnesota, and she was building an oncology program, and working on public, just sort of public understanding, public education. Like, dogs and cats make great chemo patients because it's different. Like, we're not doing the same thing that we're necessarily doing to people. So it's not an apples to apples comparison. I have an awesome picture with me and Berta. Berta is oh gosh, Spuds McKenzie, a bull terrier. And I gave her Vin Christine because I was doing part of her CHOP protocol, and it's me and Berta, and I've got my like PPE on, and we're in the kennel, and it was awesome. It was the most ergonomically sound hospital I've ever been in. It was incredible. There were no handles on any of the doors. All the doors had buttons, and they all opened independently with buttons, and they were like big buttons. So you could like hip check a button, you could elbow a button, you could punch a button. No seats wax. So all saddle chairs, which if you have not sat in a saddle chair, holy cow, like it gives you like this beautiful posture, and you can like you sit straight up and down. Everything was on one level, like no stairs, only gradual inclines, all hydraulic lift tables, like no one picked up anything.
Is that because of is that typical for the country, or is that?
I would say yes. I think that is, it's, to me, it's like going to Germany and seeing how environmentally thinking, a lot of just subtle things, you know, there's an emphasis on it. And I think, yeah, I think that was just part of the Danish culture. The Danes are fantastic people, and most Danes speak English. Basically anybody under 70, because I think there was only like 1 million or 1 million and change Danish people. So they have to speak another language because no one else speaks their language. And as you learn, many people who live in Europe, they don't speak just 2 languages. They speak 3 or 4 because they know a little Italian, they know a lot of French, they know English, and they know whatever language their country speaks. So
What a great experience to be able to go do that as a vet student. And I think, you know, we talk so much like in our mentorship program about how to connect with people and how to understand that people bring their own cultural values and differences, even if we don't know what they are. And having that type of international experience and seeing firsthand that people's ideas around chemotherapy are really different. I think all of those cultural experiences are just so important. And that's one of the things that I love about veterinary medicine too, is it can take us to so many other places. I did my externship in vet school. I went and studied parasites in Nepal, not because I was particularly interested in parasites, mostly because I just wanted to go to Nepal and was able to do that. And there's lots of groups that are popping up now, like in Costa Rica, who are doing spay-neuter clinics. I went and did one in Mexico. There's so many great things that we can use with our degrees and in this profession. For those of you who are not veterinarians, I mean, there's just so many opportunities to explore and travel and learn about different cultures. I love that story.
And if you are a veterinary student and you have the opportunity to do spay neuter in Costa Rica, you need to sign that form right now. Right now.
You go. You do that.
Do not think about that, because you will gain a viable skill. You will gain viable experience, and you will do it in the most magical place on the planet.
It's so true. Take that advice. If you have an opportunity to go do that, go. This has been amazing. I want to make sure that we've answered everybody's questions. So I'm going to do one of my famous long pauses again and see if those of you who are on the live chat or who are here live have any final questions. I've gone through the questions that people had for you, so I think we'll probably wrap up here in the next couple of minutes, but I'm gonna just pause again for those of you who are here live and see if there's any final questions for Jeff.
Again, the beer question is also very fair. If you have a question about beer, like what kind of beers do you like? Like, what's your favorite beer? That's probably not a good question because there's so many. It's hard to pick a favorite.
I mean, if anybody out here who's live wants to contribute into the chat about your favorite beer, I think this could generate a very lively discussion.
I would happily, or what's your favorite board game? Let's talk.
Yeah.
Yeah.
Do you know the veterinary Vets Against Insanity?
The Cards Against Humanity variant.
Yeah, the cards.
Yeah.
It's a good one. Someone's saying that you must try the craft beer in YVR, the craft beer culture. Have you been? Have you done Canadian beer tasting?
I have not.
It sounds like you have to. Actually,
you
must.
So the cool thing is, I have a childhood friend of mine, and we are working our way through every MLB stadium in the MLB. And this summer, it's time to take it international. So we're going to Toronto for a Blue Jays game.
Ooh.
So I know it's not Vancouver, but I will check out what the Toronto beer scene has to offer.
You're gonna have to, and then you'll have to report back to us.
And
well, this has been
thank you, Canada, for poutine. Thank you.
Yeah, thank you for
I only recently learned that that's a Canadian thing, and I didn't know.
Yeah.
So now I'm more informed, and again, glorious.
This has been awesome. I've learned so much. Thank you so much, Jeff. It was a joy to have you as our guest mentor to answer all of these amazing questions. This was super fun. Thanks for those of you who joined live and for the good discussion in the chat. And thanks to everybody who put questions in the Ready Vet Go community. I know that this is going to get a lot of interest. We're going to post this when we hang up, Jeff, live in the Ready Vet Go community so that people can see this on demand. I did take a poll with people in the community, and a large percentage of them wanted to submit their questions in advance, have you answer them, and they would see them on their own time. I think it's the nature of veterinary medicine, being veterinarians. Everyone is so busy, but really, I can't thank you enough. This was really wonderful. Hopefully you will enjoy the rest of your Belgian.
Yeah. Well, and it's pack meeting night, so I'll take a little break and then I'll have a pack meeting.
Oh, good. Wonderful. Good. You're going to be on all night.
Yeah.
All right. Thanks to those of you who joined us. Hopefully you all are part of the Ready Vet Go community. I assume that you are because you are here. If not, I'm going to do this right now just to share my screen for those people who are watching this on demand. Afterwards, I'm going to share my screen with a QR for the Ready Vet Go community. You guys who are here live can feel free to scan this. Those of you who are watching this on demand can scan this as well. Feel free to send this to your friends, post this in your socials. This community brings to you all of these really amazing free events like Drop In Ask a Mentor, our once a month race approved continuing education that you're all invited to. So please spread the word. And Jeff, thank you so much again. I hope you guys all have a really wonderful night.